As I've talked about in previous videos, triple PD, persistent postural perceptual dizziness, is actually a relatively new diagnosis. It is a conglomeration or accumulation actually of previous diagnoses. Predecessors included chronic subjective dizziness. And before chronic subjective dizziness, we actually had other subdiagnoses that helped to, I think, better characterize what was going on in the brain of someone with triple PD. Some of those former diagnoses did include phobic postural vertigo, psychophysiologic dizziness, and also visual vertigo. So within those, I'll briefly explain them. So phobic postural vertigo includes those who go to really high heights, and they will look down and they'll become very disoriented when doing so. Visual vertigo is just as it sounds. Individuals will have vertigo triggered by visual motion. And then within psychophysiologic dizziness, these were individuals who were anxious, and when they were anxious, they started to feel dizzy. They started to feel as though they were floating. One of the interesting components of triple PD is that I think it forces us to understand deeper areas of the brain, such as the parietal insular vestibular cortex. That is a long word, simply that it has a designation for a part of the brain that's deep in the brain, in an area called the insula. And the insula is a lobe of the brain actually that's kind of on the inside of the brain, and it overlaps with areas of the parietal lobe as well. So that's for the parietal insular vestibular cortex. The insula is separate, but the PIVC, as we term it, is an area that kind of borders between the parietal lobe, the inner portion, and the insula. And is it more complicated than that? Yes. We now know there are many association areas within the parietal lobe, even within the temporal lobe, that are what we call association areas, which basically process how complicated human motion and visual motion is. Because when we're not dizzy, we have this frame of reference for where our body is, and then also what's going on in our surroundings. However, for those with triple PD, oftentimes, as I mentioned in other videos, we've lost the realization of where our body is, making it easier for visual motion to destabilize us, or our own motion to create dizziness. And those are classic features of triple PD, such that if a person is moving and they're feeling more dizzy, that's synonymous with triple PD, as well as if visual motion causes them to feel disoriented, that is synonymous with triple PD. I like the example of phobic postural vertigo because it helps us to know that when somebody is at a height and they're kind of disoriented, and if that creates a sensation of dizziness, it's pretty easy to understand in that setting that that individual may not have a good understanding of where their body is when they don't have visual cues that are supporting them to help them know that they're close to things. I work with a lot of patients who may get out into open spaces and then they may feel more dizzy, but they feel less dizzy when they're in closer spaces like their bedroom. And so all of this really helps us to understand the brain. That's why triple PD is so interesting to me. As I've talked about, triple PD can be a primary issue. It can be secondary to other vestibular syndromes. And when you understand that there's damage to the vestibular system, the brain, involving vestibular pathways, recurrent BPPV, the vestibular nerve, that deprivation of correct signals from the inner ear to the brain can then lead to the brain kind of remodeling itself and not knowing what's going on. Akin, the way I think of it, is to phantom limb pain or phantom limb syndromes, And when an individual can lose their limb and they still feel like the limb is there, and it can be incredibly painful. So the brain is super interesting. Triple PD is a good way for us to understand that. I know it's not pleasant for those of you who suffer with it. But if you have any comments, questions, please let me know. Dr. Randall Gates, board certified chiropractic neurologist and chiropractic physician from Gates Brain Health on our new set. And send me your questions.